Good morning, ma'am. My name is Raquel Hatulan, a first-year student nurse at Davao Doctors College. I will be assessing your temperature today. Before anything else, I would like to confirm your identity. Your name is Rihanna Domingo. You're 20 years old. Your birth date is February 22, 2001. Your civil status is single. Are those correct, ma'am? Okay, ma'am. Like what I said, I will be assessing your temperature today. So, to assess your temperature, the method that I'm going to use is the oral method. So for the oral method, ma'am, I will place the thermometer under the side of your tongue. Okay, under either sides of your tongue, ma'am. Okay, so before I proceed, may I know if you have eaten or drunk cold or hot food or drinks before a few minutes before coming here?
No.
Okay, thank you. So I asked this to my patient because if the patient has taken anything that is cold or hot, it will affect their temperature. If the patient has taken something hot, it will increase her temperature. And if the patient has taken something cold, it will decrease her actual temperature. Okay, thank you so much, ma'am. I will just wash my hands. I will be right back. Before any medical procedure, it is very important to perform hand washing to prevent the contamination of germs and the spreading of infections. In assessing your oral method po, I will put you in a sitting position. So this one, you're already in a sitting position. So my patient will be in a sitting position because it will be easier for me to place the thermometer under her tongue. Okay, hi ma'am. Okay, I want you to know po that whatever happens here during the medical procedure, I want you to know that we will remain it as something confidential to protect your privacy. Okay? So I am now going to start. Okay, so this is the thermometer that I will use for her oral temperature. So I am going to wipe it with an alcohol swab. So what I'm going to do is wipe it from the bulb to the stem. Okay, I did this because the bulb is much cleaner than the stem. Okay. Okay, ma'am. Please open your mouth. I'm gonna put it under your tongue. Okay, please widen your mouth. No, don't do your tongue like that. Just put it higher. Okay, open your mouth bigger. Okay, I'm gonna place it here. Okay, close your mouth, please. Okay, thank you so much. Oops, please pakiipit po. Okay, so we are going to wait until the thermometer beeps. Okay, so we are using the oral method. This one is reliable because the location for the oral method is close to the sublingual artery. Okay, it has finally beeped. Okay, please open your mouth. Okay, so I got the patient's temperature. It is 36.2 degrees Celsius. I am going to clean it with an alcohol swab again. What I am going to do now is that I am going to clean it from the stem up to the bulb because the stem now is much cleaner to the bulb because the bulb was close to the location when we got her oral temperature. Okay. Okay, thank you so much, ma'am. I will just record it on my worksheet. Excuse me, ma'am. Okay, your temperature is 36.2. Okay, so now I am going to assess her temperature again. This time, I am using a different method. The method that I will use is the axillary method. So for this method, we will get the temperature from her underarm. As you can see, my patient is not wearing a lab gown or a clothing that has sleeves. She is only wearing a tank top. So later, I will just ask her to raise her arm. And also, she's already in a, not yet ma'am, also she's already in a sitting position. So I put her in a sitting position because it will be easier for me to place the thermometer under her arm. Okay, so ma'am, please raise your hand, I mean your arm. Okay, before I do anything, I will inspect if her underarm has skin lesions or perspiration. So from my observation, she doesn't have skin lesion, but she has perspiration. Okay, so I have to wipe it off, but please remember that in wiping off the patient's perspiration, you just have to tap it like this. It should be gentle. Because if you rub it, it will cause friction, and then the friction will cause heat. Therefore, it will increase her temperature. Okay, so I have finally wiped it off. So my patient is ready for the axillary method. Okay, this is the thermometer. I am going to wipe it from the bulb to the stem because again, the bulb is much cleaner than the stem. Okay. I'm gonna place it now. Okay, ma'am, please put it like this, your arms like this. Okay. Okay, so I will just wait until my thermometer will beep because once it has a beep, it means it already gathered the temperature of my patient. There is a specific time for the thermometer to gather the temperature of the patient. So the temperature has finally beeped, and the temperature of my patient is 35.5 degrees Celsius from her underarm. Okay, so I am going to record this on my worksheet, but before anything else, I'm going to wipe my thermometer with alcohol swab first. Okay. So now we're going to do it from the stem to the bulb because of course, the stem now is much cleaner than the bulb because the bulb is the one that is close in pack with the patient's underarm. Okay. I'm now putting it on my worksheet. 35.5 degrees Celsius. After assessing the temperature of the patient, it is very important to clean the thermometer so that it will be disinfected. So this is how I will clean my thermometer. Okay, first I will get the cotton and then put it with alcohol. Okay, since it is already used, I will just clean it from the stem up to the bulb in a twisting motion. Okay, so now it is clean and it is ready to be used by other patients. So now I'm just going to put it here. Place it here. And I will just put it in its storage location. So let's just assume that this is the storage location for the thermometer. So I'm placing it here because I'm done using it. Good morning, Ms. Domingo. My name is Raquel, Hatulan, a first-year student at Davao Doctors College. I will be assessing your peripheral pulse today. Before I proceed to anything, I will just confirm your identity. Your name is Rihanna Domingo, you're 20 years old, your birthday is on February 22, 2001, and your civil status is single. Are those correct, ma'am?
Yes.
Okay, thank you so much, ma'am. I will just wash my hands before I proceed to anything. Before any medical procedure, it is very important to perform hand washing to prevent the contamination of germs and the spreading of infections. So during the procedure in assessing the peripheral pulse of my patient, note that I am not going to wear any gloves because she is not in protective precautions. Ma'am, I want you to know that our medical procedure here today will remain confidential to protect your privacy.
Okay.
Okay, so I'm going to start. The pulse point that I'm going to select is your radial pulse. The radial pulse is here, it is on your wrist, and it is under the side of the thumb. Okay, so before I proceed to that, may I know if you had a physical activity a few minutes before coming here?
None.
Okay, is that true, ma'am? Because if you had a physical activity a few minutes before coming here, it might affect your pulse and it might result to the inaccuracy of your pulse, and also it might result to abnormalities of your pulse. So you didn't have physical activities. Okay.
None.
Okay, so I guess I should proceed now. Please just be in that position, that is the sitting position, so that I can easily assess your pulse. Okay. Please put your bend your elbow in a 90-degree angle. Okay. Place it in the armchair. That is good. You can, yes, your palm can be face downward. Okay. So I am placing my two fingers on the patient's wrist to assess her pulse. So as you can see, I am not going to use my thumb because my thumb has its own pulse, and I might mistaken that as my patient's pulse if I use this. Okay. Okay, so I have finally felt her pulse. I am just feeling it to see if her pulse is consistent. I now have my watch that I will be used in counting her pulse. Since her pulse is regular, I am just going to count for 30 seconds and multiply it by 2. I'm gonna start counting now for 30 seconds. So I have finally assessed the pulse of my patient. So for the rhythm of her pulse, it has equal time period between beats, and for the volume of her pulse, it can be felt with moderate pressure. So her pulse is 72 beats per minute. Okay, so that is within the normal range because the normal range is between 60 to 100 beats per minute. Good morning, ma'am. My name is Raquel. Hatulan. I'm a first year student nurse at Davao Doctors College. I will be assessing your respiration today. Before anything else, I would just like to confirm your identity. Your name is Rihanna Domingo. You're 20 years old. Your birth date is February 22, 2001, and your civil status is single. Are those correct, ma'am?
Yes.
Okay, thank you so much, ma'am. So you know that I will be assessing your respiration today, right? So there are several factors that affect your respiration. So I am going to ask you questions that are related to that. Okay, the first one is, have you had a physical activity before coming here or a few minutes before coming here?
No.
Okay. Are you stressed?
No.
Are you, I mean, do you have present medications?
No.
Okay, so thank you so much for answering that, ma'am. I asked you those questions because those factors might decrease or increase your respiration. Okay, so before I actually assess your respiration, I will first wash my hand. I will first perform hand hygiene. Okay, I'll be right back, ma'am. Thank you. Before any medical procedure, it is very important to perform hand washing to prevent the contamination of germs and the spreading of infections. Okay, ma'am. For the procedure, it is very important that you follow the directions that I asked you to do so that the flow of our assessment will go smooth, okay? If there are things that you're uncomfortable with, you can tell me. And also, if you have clarifications, please don't hesitate to ask me, okay? Okay, whatever happens here during this medical procedure, it will remain confidential to protect your privacy. Okay, ma'am? Okay, so now I am going to start. Okay, I will put you in a Fowler's position. Okay, ma'am? I will put this one down. Okay, you can lie down. And then, okay, so I put you in a Fowler's position so that I can observe your breathing properly. Okay? Breathe for me, please. So, assuming that the patient doesn't know that I am going to count her respiratory rate. So some nurses don't tell the patient that they're going to count the respiratory rate because there are cases that the patient can alter their respiratory pattern once they know that that they are being observed. Okay? I'm gonna transfer it. So, from my observation, her respiratory pattern is normal. So, I am just going to count count her respiratory rate in 30 seconds. Okay, I am going to start now. Okay, so also upon counting, I also observe the rhythm, the depth and the character of her respiratory pattern. So now I have gathered the respiration rate of my patient. Also, I have observed the depth and also the rhythm and the character of her respiration rate. So for the depth of her respiration rate, it is a deep respiration. And for the character, it is evenly spaced, and for her, for the rhythm, it is evenly spaced, and for her character, it is silent and effortless. And also, from my count, her respiration rate is 16 breaths per minute. It is normal because 16 is within the normal range of respiration rate. Show how to measure the blood pressure. But before anything else, I should prepare my equipment. The equipment that I need are my aneroid sphygmomanometer and my stethoscope. So I have to ensure that my sphygmomanometer has no damages. So for the size of this, it is as what the box says, it is the standard size cuff. So I have to inspect it. So this is the cuff. The cuff is the standard size. There are no damages. This is the hose or the tube. It is properly attached to the cuff. And the aneroid manometer gauge, it is at 0. And then my inflation bulb. So there are no damages. And for my stethoscope, this is my stethoscope. I would need my stethoscope to listen to the blood pressure sound. Good morning, ma'am. My name is Raquel, Hatulan, a first-year student nurse at Davao Doctors College. I will measure your blood pressure today. Before anything else, I would like to confirm your identity. Your name is Rihanna Domingo, you're 20 years old, your birthday is February 22, 2001, and your civil status is single. Are those correct, ma'am?
Yes.
Okay. Thank you so much, ma'am. I'll be right back. I will just wash my hands. Before any medical procedure, it is very important to perform hand washing to prevent the contamination of germs and the spreading of infections. Okay, ma'am, I would like you to know that whatever happens during our medical procedure or whatever result we will get, it will remain confidential to protect your privacy. Okay, so before I proceed, may I know if you ingested caffeine or smoked 30 minutes ago?
No.
Okay, I asked this because smoking constricts blood vessels and caffeine increases pulse. So both cause increase in blood pressure temporarily. So I will now ask you to be in a sitting position. So you are already in a sitting position, that is great. But now I want your feet to be flat on the floor because crossing your legs at the knee will result to elevated systolic and diastolic pressure. And I want your arms to be on your heart level because if it is above your heart level, it will decrease your blood pressure. And if it is below your heart level, it will increase the blood pressure. Okay? Okay. So I will first inspect or palpate which arm I should first use for your initial assessment. Okay? It should be in heart level. Okay, so it is much easier to use the right arm of the patient. So I will first measure her blood pressure on this side, or first do her initial assessment on this side. So I'm going to use the patient's right arm for the initial assessment. I have now located her brachial artery, so this will help my reading to be accurate. Since this is the initial assessment of my patient, I am going to perform a preliminary palpatory determination of the systolic pressure. So I won't be using this yet. I will only use my sphygmomanometer. So it should be 1 inch above the pulse. And the pulse should be between the two tubes. So I felt her pulse at the systolic of 70. So next, I am going to measure her blood pressure. But before that, I should let the patient rest for 1 to 2 minutes. Okay, ma'am, I gave you 1 to 2 minutes to rest because a waiting period gives the blood drop in the veins time to be released. So now I am going to measure your blood pressure. But before that, I have to clean the earpiece of my stethoscope because if this is clean, I can hear the sounds properly. I am just going to clean it with an alcohol swab because I don't have wipes. I have cleaned my stethoscope already, so now I am proceeding to take her blood pressure. Okay, it's here. I am placing my stethoscope on her brachial artery so that while I get her blood pressure, I will hear the diastolic and systolic. Be sure that it is closed. So from my measurement, it is 90/70, and to be sure, I will repeat it again. But then again, I'm gonna give the patient 1 to 2 minutes to rest. It has been 1 minute, and I'm going to reassess the blood pressure of my patient to confirm the accuracy of my first reading. Okay, I got it here. Okay, so from my reading, my first reading was 90/70 and now it is 90/60. Since this is my patient's initial blood pressure assessment, I'll have to do it on her other arm. Okay. It is 90/70. I'm just going to disinfect my cuff with an alcohol swab so that it will be safe for the next patient that will use this.
I have recorded the results of my assessment in the TPR graphing sheet. For the temperature, the oral method was taken at 4 a.m. It was 36.2 degrees Celsius. The axillary method was taken at 8 a.m. It was 35.5 degrees Celsius. For the pulse, taken at 4 a.m. was 72 beats per minute. For the respiration rate, taken at 4 a.m. was 16 breaths per minute. The initial blood pressure on the right hand was 90/70, while on the left hand was also 90/70.